I think a lot of people want to know, is the pandemic over?
No, that's a super important question. And it's really important that we make that clear that the pandemic is not over. We obviously are in a better situation here in Illinois. We have the lowest number of cases, the lowest test positivity that we've ever had in this entire COVID journey. But of course, when we're still identifying 500, 1,000 cases, when there are still over 1,000 people in the hospital, we're still getting deaths reported every day. Of course, it's not over. I guess the important thing is, do I ever think it will be, COVID was never going to leave us. I think we have to understand that, but we are going to be in a situation where we are more controlling it than the virus controlling us.
God forbid, but if this were to ever happen again, are we prepared?
I would say you always are better off, the second time around if you're willing to learn from what you've been through. And I think there have been so many teachable moments, never let a global pandemic go to waste. So we absolutely have learned so much. And I trust that public health professionals, healthcare professionals, community organizations, we all, we're going to be doing that super hot wash and figuring out all the pieces, but so many lessons to learn that will be things that will help us be better prepared for the next pandemic, which won't be 100 years from now.
Is that effort already underway, the effort to rewrite the playbook?
No, definitely. We are going to be receiving, we have been receiving, we're going to be receiving funds, and a lot of those funds have to be not just for the here and now, but what is the actual public health infrastructure that we need to be better prepared. And so we are thinking not about now or 6 months from now, but what do we need for the years and the decades to come to be in a better situation than we are now. So those plans, those ideas, that brainstorming is taking place now to make sure that our next pandemic will be even more prepared.
I wonder when the coronavirus really showed up on your radar. Looking back at the timeline, I question when global health authorities started to really take it seriously. The first 2 weeks after the first reports coming out of China, it had spread to 2 countries. 3 weeks, it had spread to 4. 4 weeks later, it had spread to Europe and other countries. By 8 weeks, we knew of presence here in the US. I don't know how quickly that tracks with other outbreaks, but when did you realize it's coming here?
So we had started, our first case was January 24th, and then the second case was a week later, and it was the spouse, and then it was a whole nother month before we saw cases 3, and then a few days later 4. But even before that first case, we were already in conversations, all the state health officers, even the city commissioners, we were in talks with the CDC. The CDC was already convening, calls and meetings to discuss, what was potentially coming. So before our first case, we knew that we were going to be on the brink of something, that we were going to be facing something pretty significant, and we're already trying to lay the groundwork and the framework for what was pending.
Was there ever a realistic chance to contain the coronavirus or stop it from getting out? And if so, where did we miss that?
Of course, hindsight is 20/20, but when we were identifying that first case, that second case, clearly there were already cases, in the state before those first identified cases. It's not like, we identified a case on January 24th, and that individual had come directly from the hotspot, which was Wuhan. I'm sure on that plane were hundreds of others, and on how many flights, when you think about how many flights come in from that area per day, per week, and how many had been coming in every single day for the preceding weeks and maybe month and a half, we know that maybe there had to have been cases already in. With testing, there was no test, right? There was no test for this. So it's not like, oh, we'll just pull out and let's check the COVID test. There wasn't a test for this. So, the rationing, when we had few supplies, figuring out who we should test. So we clearly missed people who must have had it, who may have been circulating in the community. Maybe, again, people didn't have the symptoms, and we were looking for specific symptoms. So again, our learning about the virus kept evolving, and we gained more capacity as we were go from testing a dozen people, 15 people, 100 people to 1,000 people, then eventually up to 100,000 plus per day. That capacity can't be built overnight.
It sounds like you're saying, given what we know about how the virus transmitted now, that it was probably spreading faster than our ability to even find it in the early days. Are you curious at all to know more about the origin? We heard the former FDA commissioner just, I guess it will have been 2 weeks ago once the time this airs, the former FDA commissioner just recently said we still haven't found that link, how it might have gotten from animals to humans. How curious are you to know where this really came from?
I think I have enough to worry about in terms of trying to keep the people of Illinois safe and try to prepare for the next one, to try to minimize the impact that the next pandemic will have. I know there are people who are looking into that. I think there'll probably be commissions looking into that, and I'm of course I will follow the results of that. But I think I have enough on my plate.
I didn't know if there was like a hobby where you were just reading, because I remember early on in the pandemic, most of us would just read the Wall Street Journal or the New York Times and think, oh, this is a mysterious thing happening half a world away, and soon enough it would visit us with a bit of a vengeance. As we build this playbook to update for that next occurrence, should that happen, how will we change the approach? You mentioned sending out supplies and things to places of concern. What were some things we could have done to build up our defenses better at some of these congregate living centers, senior homes, places like that? Were there any things we could have done to shore up our defenses there?
So I think, again, hindsight is 2020. I mean, we can think of all kinds of things that could have changed the trajectory of the infection, but I think we know that we need dedicated staff in our long-term care facilities whose primary job is infection control. We know that we need ongoing training of staff, of healthcare professionals in general, just focusing on, disease mitigation, infection spread, how to limit the spread. We know about different kinds of hand sanitizer and which kinds might be effective and appropriate in certain settings. So there's a lot to appreciate. I think something that's pretty basic is just vaccinology, being able to understand what vaccines are, what they do, why they are of benefit, and being able to have people accept how much vaccines have advanced our society to the point that we embrace vaccines when they do come online to help protect people from the diseases that they are intended to prevent. So I think, we want to see our healthcare professionals, people in congregate settings, people who are working with the most vulnerable, we want them to do everything they can to protect the people they're caring for, whether it's washing their hands, wearing masks appropriately, or getting vaccinated when that's the option as well.
It sounds like maybe you're alluding to this problem of misinformation, which was spelled out in 2014 in the state's pandemic preparedness plan, the playbook. It said that misinformation trends must be identified quickly and rectified. My grandmother gets a lot of her news from Facebook. She likes to forward some of those articles to me, and I don't know where they come from, but they have a lot of confusing information in there, and it really spreads quickly, maybe like a virus. How did the internet complicate your ability to communicate with the public in a clear way?
No, definitely, like the salacious, very very over-the-top stories, like those gain traction like that, and they pick up steam and they grow. And so when you're chasing that, it's like just such an uphill climb, but I think if there was just a better foundation of what people understood about vaccines, and again, vaccines are their own enemy because they work so well and eliminate the diseases that they're intended to. People don't appreciate what they've done. I always think about, polio. if there were kids who, were doing double dutch, jump roping, and they had to wear braces because they're recovering from polio, that would be like a reminder that, oh yeah, that person had polio. But nobody has polio. So you don't think about how the vaccines completely eradicated that. So they do such a good job that they even make themselves, they even make it hard for themselves to make their case. But really understanding the role that vaccines have played as one of the top innovations in medical history of the last century, I think having that more top of mind instead of something where vaccines don't really matter that much and you can choose to go for it or not, it doesn't really matter. That cost us a lot.
I wonder, I think the data bears out that we saw that in younger populations, for sure. Popular people who had, I think the world's leading podcast is hosted by Joe Rogan. You might have seen his comments that if you're young and you're healthy, you don't need the vaccine. That was what he said. He took some pushback for saying that, but to someone who might have been young and healthy or who might have contracted the coronavirus, if they're looking at this decision about whether or not to get vaccinated and they say, well, the vaccine is going to give me the antibodies, but I already had it, so my body has antibodies, what would you tell that person? Should they get the vaccine, and why is it different or safer for them than just being exposed to the virus before?
Yeah, and so I know that the CDC did recommend that people get vaccinated even if they had the disease, because when you think about people who had the disease, there were many different buckets. Some people found out that they were positive because they tested, maybe because someone around them was. So maybe they didn't develop symptoms, but they actually turned out to have a positive test. Some people actually had an illness, maybe it was super mild. Some people maybe had a significant illness, and anywhere along that spectrum. And again, with a brand new virus where you're not clear if the person who was completely asymptomatic would actually develop antibodies and have that same robust response as someone who actually got very ill and then overcame it, when you don't know for sure, it makes sense. Here is something, a specified amount, everybody's getting it. We know that this causes a reaction and stimulates that immune response. Instead of guessing that maybe you did, you didn't, this is the thing that we're sure of. And so I think that is kind of the foundation under saying everyone does, because it is true that in other diseases, you want either infection or the vaccine. But again, with a new virus that you're learning as you're going, trying to protect as many people as possible, you err on the side of caution.
I think that makes sense. Did you ever expect that one of the items that would help incentivize people to get the vaccine might be a shot or a beer? What do you think of these sort of gimmicks?
I mean, I think I understand that, it's coming from a place of, there are people who are on the fence. So, if someone has a religious conviction that they are holding steadfast to, I don't think that a beer or a concert ticket would sway their religious convictions. So it's people who are just, I'm just holding out, I'm waiting. I don't really have a significant reason to, but I'm not going to bother with it right now.
Not so much vaccine hesitancy, but vaccine apathy?
Maybe. So if it's vaccine apathy, and so you're just trying to nudge that along, and this benefits the entire society, right? So everyone's vaccine is not just a benefit to that one individual. Of course it benefits that individual, but it benefits our entire society. It benefits the 8-year-old with asthma who would be high risk that can't get vaccinated. And so trying to nudge, the people who are apathetic that just need that little push, I think, it makes sense in a way.
And the numbers are certainly improving as the vaccine rollout happens. I noticed also, I went back to the playbook. I wanted to learn more about how prepared the state was and how we might be better prepared in the future. And it really struck me that it kept talking about messaging. And I wonder how much of this was a public health crisis or a public communication crisis. For example, it said that the state must coordinate messages to ensure consistency and to build public confidence. But how do you coordinate messages when the states surrounding us all have very different ideas of what it means to be open and safe, or closed and safer? And then the public can go online and see, well, wait a minute. They have high school sports in Missouri and Indiana, and our numbers aren't drastically different in any meaningful way. How did those messages make your job harder, having different policies in different states and counties?
Well, I think everyone knows that there are, 50 states that all have their own lead and they all make their own decisions, and no two states are the same. I think what is consistent is that what we understood, what the science was evolving and telling us. But how people want to implement strategies to deal with that science, yeah, that's going to be individualized to states, and how state leaders, what their bent is, and how much risk they want to take, what their risk tolerance, what communities they have that they're trying to protect. So it's not that, the message is the same in terms of we have this deadly virus, it can do X, Y, and Z. How we want to deal with that, yeah, all the states are going to come at that a little differently.
And even in the last few months, I think most people saw, okay, that the end is in sight. There's a bit of relief on the horizon. But there were still some states to open up everything faster. And when the public didn't see a big surge after it, did that affect your decision making at all? When you saw states like maybe, I don't know, Texas or Florida say we're going to let everybody into the baseball stadiums, from what we had been taught to learn over the last year, that would be a super spreader event, right? But at this stage, with the vaccine rollout, it didn't pan out that way as things changed toward the end. So I guess I'm asking if there were examples of other states taking a different approach. Was there ever an example there where that state's approach informed what we do here?
Everybody's experience was forming the fund of knowledge that we were all drawing from, right? So, when they say that we're going to try doing this, then everybody is paying attention. Like, we want to see, that's almost in part of the research in itself. That's an experiment in itself. And so we all were learning. We always thought that outside was safer, that just, the ventilation was better. So that hasn't changed. And we do know that we have had outbreaks that have even been in outdoor settings. And so, it's all a balance. Like, I think we're all working with the same science, but again, how we want to implement that and how much risk we want to take versus how much caution, like that is what changed from state to state.
I've never seen a Department of Public Health be so actively involved in everybody's everyday life. The department here must have been stretched to the limit, I'm sure. You mentioned earlier that Congress is sending a bunch of money to the state public health department, to county public health departments. When this is finally, if not off your radar more than it was last spring, what's next for the Department of Public Health? Are there other crises that we face as a society that you feel this department has built its muscles up for that you can tackle next?
No, and I don't want to give the impression that all the other work came to a halt, right? We have been working intently on maternal mortality. We actually put out a report, it's 2 years since the last report, talking about the women who died related to childbirth within the first year. We put out important information around that because of the report that we had put out prior to that. That's why we're the first state in the nation to have the waiver that would extend Medicaid for women, not just 6 weeks postpartum, but an entire year, because we've seen that loss of health care is part of the reason that people didn't get the care they needed to hopefully, prevent certain deaths. We still have a getting to zero plan where we were trying to get rid of HIV, get all HIV significantly down. Lead poisoning in areas throughout the state, that is still something that's very important that's going on with the environmental health. So many programs, the 200 plus programs that IDPH is over, are still happening. We have obviously shifted people and maybe haven't given it all the attention, but those are important things. Newborn, every baby that's born in Illinois still gets tested for all of those diseases that if we can identify early, maybe you can intervene and save a life, give the appropriate treatment, et cetera. So all of those things continue, but we also have to figure out what are the new things that we need to reinforce or double down on so that we can make sure that another pandemic won't look like this. And so we know that chronic disease. So age was a huge risk factor for COVID. You know, the older you were, the more likely you were going to have an adverse run with COVID. That's not something you can change. But the amount that of chronic disease and how certain conditions also portended a worse outcome, those are things. Most chronic diseases are preventable, right? Diabetes is preventable. We can prevent high blood pressure. We can prevent obesity. So if we really double down on those efforts around health promotion and help people not to have those conditions, then you just have a less susceptible population, even when that next virus, whatever that next thing is, tries to come through.
Those are some of the vulnerabilities we carried with us as a society into the coronavirus. What are some of the ones we're going, maybe the new or exacerbated problems we're going to carry with us on the way out? Are there ripple effects? For example, the playbook for the state, again, I'll go back to that. It said that in handling a pandemic, we should try to prevent mortality, morbidity, and social disruption. We couldn't quite avoid preventing social disruption. We had quite a bit of that. Are there any new challenges that your department faces now because of all the rearranged and disrupted social norms?
Yeah, and so, you know, obviously that's the goal in anything. We want to minimize morbidity, minimize mortality. At the time, with a brand new virus that we didn't have a cure or a vaccine for, unfortunately, the things that would actually minimize morbidity and mortality also would cause significant social changes and or disruptions. And so trying to strike that balance was a continual thing that we were moving towards, you know, along this journey, trying to find that middle.
Very interesting. I have to ask, because I think a lot of Americans have been very excited to get back to a concert. We heard a lot from you, but not as much about you during all these daily press conferences. What's the one concert that you would most want to go to once this is all over?
I don't even know like what's on the docket in terms of, I have not.
Any musician, living or dead, you want to go to a concert?
No, I love music. I love jazz. I love rock. I love hip hop. I love really all genres of music. I don't even have a single song that I've ever downloaded. I just flip around on different stations, or, you know, my kids will play stuff for me. So I'm just a lover of all music. So any concert that's available that I can get to, I'll be excited to enjoy that.
We might see you at Lollapalooza this year?
Maybe.
Not your speed?
No, I've never been to that, and that's not for my peer group. Maybe I think I probably missed my chance for that. But if they had something maybe a little bit more age appropriate for me, like I could look into that.
All right. Well, Dr. Ezike, thank you, and congratulations on entering phase 5.
That's great. No, the pandemic's not over, but I'm really looking forward to us having an incredible summer. I think it's really important that people realize that, you know, you may be able to put away your mask in many situations, and you might see others that still have it on, and we can't be involved with mask shaming. Nobody knows what individuals' risk tolerance is, or what their specific risk is, or what medications or what situations they find themselves, or who they have at home that they're trying to protect. So it's going to be very individual as people make the appropriate calculations and try to do what's best for themselves and their family. And everybody needs the space and the respect to be able to do that.
Great. A little dose of kindness goes a long way.
Yeah, right.
All right. Well, thank you very much.